Thank you for joining our panel. My name is Dr. Jennifer Turner. I'm a senior research associate at IWPR. And this panel is, sorry, my notes are kind of like a mess. The undervaluation of human services, of care work, excuse me, in the human services sector. And so I'm going to start by introducing our panelists. I just realized I don't have a page of my notes. I'm so sorry. So actually, I'm going to improvise for a second. Do you all mind introducing yourselves? Because I don't have a page of my notes. Okay. All right. So I'm going to start with Dr. Nancy Fulbright. Go ahead.
Hi, everybody. I'm really happy to be here. I want to begin by building a kind of bridge between the last session and this one by asking you a question. Is care undervalued because it is primarily provided by disempowered groups, especially of women of color? Or are disempowered groups concentrated in or relegated to care provision because it is undervalued? This is not an either-or question. The two go together, and I think understanding the way in which they reinforce each other is really key to our project. So what I'm going to dwell on is the second part, the second possibility, looking at how the devaluation of care provision itself is a force in reproducing gender and racial inequality. But I just want you to be aware that I'm really emphasizing the circularity of these two different approaches. And I do come at this as very much as an economist who's critical of market dynamics. And I believe that care is undervalued for two really important reasons. One is it has many of the characteristics of a public good. It spills over in ways that benefit many others besides the direct recipients. And that makes it very hard to capture the value of care provision in a market-based economy that's based on kind of per unit prices and the way they affect supply and demand. And then a second reason for its undervaluation is basically the people who need it the most are least able to pay for it. So these are arguments about the undervaluation of care that are very directly related to reliance on the market economy and the logic of capitalist exchange. So I'm needing my next slide, Yeah, so virtue is its own reward. That's kind of the way in which economists think about the undervaluation of care provision. And instead, I want to emphasize the high price of doing good. Next slide. So kind of an overview background. Employees in care occupations and industries are paid less than comparable workers in other jobs, even other care jobs. And this is because they provide social benefits and public good, and their commitment to the well-being of their clients also reduces their bargaining power. Okay, social assistance workers are especially disadvantaged because their clients have little political voice and are often culturally stigmatized. So this is the point about people who need it most or least able to pay for it. But also, increased subcontracting to private firms has been a cost-cutting strategy in the public sector that has put downward pressure on wages. So here are some basic trends that are relevant to the numbers. There's been declining unionization of workers in social assistance occupations from 24% in 1984 to 11% in 1984. There's been increased subcontracting out of the public sector. 58% of workers in social assistance were in the public sector in 1980. Now it's only 25%. For both men and women, earnings relative to other industries have declined since 1980. That's what I mean by the high price of doing good. And today we're facing major staff shortages and really high turnover in the sector that's contributing to the larger care crisis. So just to be clear, within the social assistance category, there are a bunch of different categories: individual and family services, community food and housing, and emergency services, vocational rehabilitation services. But these are obviously going to groups that are very politically and economically disempowered. And we focus on these particular subcategories in the social assistance industries, and also look at some other care workers employed in health and education. And we use some data from 2015 to 2019, pooled over those years from the American Community Survey. And we focus just on full-time, full-year workers, just as a first cut at looking at what the penalties are. So in these industries, these social assistance industries, 75% of the workers are women, compared to 40% in non-care industries. 21% are African American, compared to 11% in non-care industries. 42% have a bachelor's degree. So actually pretty well educated relative to the overall average. 45% of them are employed in nonprofits. So nonprofits are really dominating this sector today. 25% only in the public sector, and 30% in for-profit sector. So here are just some numbers on annual earnings of full-time workers with a bachelor's degree, because we want to control for education and just look at comparisons across those with a bachelor's degree. So in social assistance, we're talking about, in 2019 dollars, earning $42,000 a year. In other care services and health and education, $52,000. In non-care industries, $70,000. So just those descriptive statistics kind of make the general point. But to kind of dig deeper, we want to do some statistical analysis and some regression analysis, looking at controlling for a lot of different characteristics, both race, ethnicity, citizenship, gender, and so forth. And what we see is that overall, among workers in care service industries, the penalty is about 11% compared to non-care industries. Banking and finance is a good example of a non-care industry. Social assistants are earning 23% less than workers in non-care industries like banking and finance. Within social assistance, nonprofit employees are earning less than for-profit employees, and public sector workers in healthcare and education pay the greatest penalties. But in social assistance, what's really distinctive about it is the pay penalties are largest within the nonprofit sector. And basically what's happening is there's a selection process that people that really want to help others are willing to take a pay cut to go into this industry. But then what they're finding is that the pay penalty is making it very hard for them to sustain their commitments. And as a result, we see pretty high turnover and pretty serious problems with labor shortages and quality issues in social assistance. And these have really big kind of ecological consequences for poor communities that contribute, I think, to a lot of problems on the community level that we should think about in the same way that we think about the healthcare of individuals. We should be thinking about the healthcare of communities and recognizing that the underpayment of social service workers in these industries is really actually quite costly to society as a whole in terms of its consequences for entire communities. So if you're interested in seeing the numbers in more detail, feel free to contact me. I do have, with my co-author, a draft of a paper. Hopefully it will be peer-reviewed and accepted for publication in the near future. And in the meantime, it would be great to get any comments that you might have on it. Thank you so much.
Thank you. So next we'll be moving on to Ariane Hagovich, who will be talking about unequal pay for equal worth, demonstrating the undervaluation of human services work using comparable worth principles.
Thank you. Is this on? Thank you so much. Thank you so much, Nancy, for this introduction. I'm going to be a bit more niche, but before I start, I also really want to call out Lauren, who is funding our work and making it possible for us to dig in more deeply into these connections of who does the work and why is it so underpaid.
The Kellogg Foundation.
Right. And this project and this presentation, in a way, comes out of a very proactive way of trying to raise pay for human services workers, which brought a lot of us on this panel together. And Jenny Romick led that project, and she will say more about it. So as I said, I'm going to be a bit more niche, but also going to look at the undervaluation of human services work from a comparable worth perspective. And the reason we're looking at this comparable worth perspective is because in the UK, using this very niche kind of technical way has been used to really revalue or try and revalue care work in the public sector and to some extent beyond. And it has done this by involving workers and unions and organizing around care. So very quickly, we've already heard a lot about the facet of fact of occupational segregation in the United States. Something like 4 in 10 women and 4 in 10 men work in occupations where they are the large majority of the workforce. And I think it's also important to remember that, you know, this isn't just in occupations, it's in industries. And in industry, you would expect more of a mix of workers. But in fact, as we know, in healthcare and social assistance industry, almost 4 in 5 workers are women. And in construction, about 9 in 10 workers are men. And construction is the sector which receives generation high levels of federal funding. So part of what we're also hoping to do is discuss how we can balance this out. So this issue of the undervaluation of women's work in almost all other high-income countries is recognized as pay discrimination in law. In the United States, we have equal pay for equal law. In elsewhere, and including in Canada, but also all of Europe, Australia, all high-income countries and some middle-income countries, pay discrimination includes a prohibition of underpaying people for equal value. And that's really what we also were trying to reflect in our project in Seattle. How do you operationalize that? Through job evaluations, typically in organizations, that's already very established. If you think organizations have lots of different jobs and they need pay relativities, you can't just rely on the external market. Historically, though, just because you have a job evaluation which looks at different elements of a job, you know, if you think you compare apples and pears or apples and oranges, you weigh them, you look at nutrition, you look at how much sugar is in there, at the size, whether they make children happy, whatever, right? There are lots of different ways. So that's the same with job evaluation. And these can, of course, be biased by thinking somebody picking up trash as a trash collector works in much dirtier environment than somebody who works in a hospital and has to deal with human waste. So what we worked with somebody from the UK, from a union, they have for 1.6 million workers there, they developed a gender and racially reviewed, hopefully unbiased job evaluation. And the factors that are used to break jobs apart are effort, initiative independence, skills, environment, responsibility, and you see knowledge there. But importantly, knowledge is not measured by degree typically, but what you need on the job, because historically, men have kind of said, oh, I've got this thing, pay me more, right? But it had nothing to do with the job. Now it's switched a bit now. Women have to get educational attainment or show it for every little step of the way. However, job evaluation is deliberately kind of marginalizes, if you like, formal attainment that you need. And as I said, this scheme was developed with unions and external experts. And just to give you an example, too far. Okay, here is one example. And when Jenny comes, she has a beautiful QR code, so you can probably read it better if you look at the QR code. So this compares a teaching assistant, which really is a childcare worker, early childhood worker in the nonprofit sector in Seattle, with a public sector administrator also in Seattle. And these things are set up by interviewing a lot of people in detail about their job. And as you can see, firstly, if you can see, right, you probably can't see, the teaching assistant was paid just under $40,000 a year, and the administrator close to $80,000. However, her overall score on the job evaluation is higher. And the particular bits where there are differences, this does not, no, I just wanted to highlight to use the laser. You can see there on knowledge. If you work with children, typically there are lots of regulations. You need to recognize signs of well-being or lack of well-being. You can see where the job scores higher is also on physical, mental and emotional demands. Physical demands, we get this a lot, trying to get women into construction, saying, oh, they're too weak. If you lift up a child, you have to do quite a bit of lifting, crouching, playing with them. And then there's the stress of supervision and being responsible for young lives, but also interacting with the parents. So they're not too different overall, but different on some regards. However, the pay is vastly different. So question is, okay, what do we do with all this? What's it relevant to anything, right? As I said, in the UK, firstly, it is implemented, and because they have comparable worth value, the wages of care workers were increased substantially. But importantly, it was also a organizing tool to help people see the value of their work. And these interviews that are being conducted with job holders, a lot of them, you need to train them almost before so that they see all the facets of their jobs and don't just say, oh yeah, I play with kids, right? So the second one is, can we use equal pay? Can we use this concept within US laws? Some of the states are trying to move that way. In the state laws by having equivalent and equal way. We don't quite know yet how this will work out in practice, but there have been attempts to get this anchored into law. Can this inform collective bargaining? There has been in Europe, big issues pushing unions to look at different groups of workers that they represent and getting them to negotiate for more equal bits. And here, actually, there is a case going on where this kind of fits in, which is wardrobe organizers in the film industry and stagehands and set designers, right? And you can imagine who are the women, who are the men, and who gets paid more. And lastly, question is, can we integrate such a perspective into public procurement processes in supportive states and local authorities? Can we do something, say, construction related, care work related, and how can maybe do this? So these are just questions for the future. And now I hand back to Jennifer.
Thank you, Ariane. So now we will move to Sarah Butts. And Sarah, I'll let you introduce yourself if you want, but the title of Sarah's presentation is The Undervaluation of Care Work in Human Services advocating for the social work workforce?
Thank you so much. And thank you for having me today. This is awesome to be here with you all. I'm the Director of Public Policy at the National Association of Social Workers, headquarters office here in Washington, D.C. We have 55 local chapters that also work on our state legislative agenda. In my unit, we work on the policy advocacy, mostly with Congress, the administration, federal agencies here. But we also have a PAC, and we do the campaign side of the work. So I won't be able to get through everything here, but I'm glad to talk to any of you that are interested. So really quickly, NASW has one of the largest policy portfolios of any DC-based organization. We advocate for the social work workforce, which is really advocating for caregivers across the country, as well as a whole array of social justice issues that really range from cradle to grave. This is a huge task because policy advocacy requires deep expertise and understanding of detail. The progress that we can make here in this town especially is incremental and is largely dictated by the external environment. Just want to emphasize that if you're interested in our policy work, our whole agenda is detailed in this 2021 Blueprint of Federal Social Policy Priorities. I'm really going to talk a lot about some of the work that we're doing around the workforce. And just want to emphasize that sometimes folks can get discouraged in the political environment that we're in to say that we can have a positive impact whether we have a friendly administration, supportive Congress. There are opportunities to make progress and there's opportunities to fall back, and we cannot lose sight of that as we try to translate our research and advance our policy agenda. So really quickly, first thing that you need to advocate for a workforce or for our clients in the communities we serve is data. And unfortunately, for social work, we don't have great information, you all. Even I've met numerous times over the last 5 years with HRSA, with the Department of Labor. The federal data that we have on the workforce isn't great. Social workers work across many different settings with different associated scopes of practice. We're trained at the bachelor's, master's, DSW, and PhD levels, and this is a critical need. So we need scholars to study about social work, where we work, the impact that our services are having, particularly if we're saving money or increasing or improving health outcomes or well-being. That's what Congress wants to hear. And so I want to talk a little bit about the information that we do have to kind of give some context. But you'll see that if you look at social workers, it's consistent with what we're hearing here. 86% majority female profession, that there's consequences of that. And we also need men in the profession. There's about 700,000 social workers in the country. About 250,000 of them are clinical social workers. That is, they have a master's degree and have met the postgraduate requirements to practice independently. Almost all of those postgraduate requirements in social work come after the master's program at the expense of that social worker. Their supervision is unpaid. Their field practicums are unpaid. They have to pay for CEs. They have to pay for multiple licensing exams, all on the backs of the practitioner. So it's very difficult to get from high school through the education that you need to be a professional social worker. We don't often kind of toot our horn, I guess, but we are a pretty diverse workforce already, particularly in terms of incoming new social work graduates. We have high percentages of aspiring social workers of color, for example, who are bilingual. But we also have as much as 46 or 41%, something thereabouts, of new first-generation college graduates in the profession. And there's an economic consequence of that. And so we need to use this data to justify the investment in our workforce. We are already doing some of the things that say Congress says they want to attain with a provider group, but we don't have sufficient support. Okay, here we go. Where am I supposed to point? Okay. I think I missed a slide. Okay. Median pay around 55,000. Starting pay closer to 47,000. We have obviously social workers that are salaried employees and some that are receiving insurance reimbursement. Both sides, there's problems. We have whole entire child welfare workforce where as much as 20 to 40% turnover in those positions, and we have a significant amount of student loan debt. About 67,000 is what the data says for new graduates for a bachelor's and a master's degree. But we know that our students of color have much more. I think it's around 90,000 for our Black students that are new grads. And to put this in perspective, I helped to facilitate 2 social workers testifying before the Senate Banking Committee in the last Congress. One had over $200,000 of student loan debt and had never gone to a private school. So significant challenges with lack of investment in student loan debt relief, as important as compensation. So I'm going to try to give you some examples of the structural problems and the challenges we have with advocacy by focusing on Medicare. Folks say, why do you focus on Medicare? Well, that's because Congress has authority over the Medicare program. In Medicare, their clinical social workers have been providers for many years, since 1989. But our reimbursement is 75% of the physician fee schedule. With that in perspective, psychologists are paid at 100% of the physician fee schedule, sometimes for the same service, which is the case for psychotherapy. NESW has been working on this issue for well over 10 years. There's been a bill in Congress probably for 15 years in related advocacy, getting these bills reintroduced every single Congress. We still have not passed these provisions. And there are problems associated with our scope of practice in that it hasn't also been reevaluated since the late 80s. Our definition in the Social Security Act is limited, which means that we're not able to practice at the top of our scope, which precludes us from billing a whole array of services that would be useful, okay, to the clients and communities that we serve. This obviously impacts professional social workers accepting insurance, but definitely accepting Medicare or Medicaid. So these things need to change. When Congress passed the mental health parity bill over 10 years ago now, I believe, Medicare was not considered. So Medicare is not accountable to the parity laws that we have in place. Just want to say that one of the recent progress that's been made is that marriage and family therapists and licensed counselors can now participate as providers in the Medicare program. They lobbied and worked to advance that bill for over 25 years. And that was just passed last year. And they can now serve clients in the Medicare program as of January of this year. I keep them pointing in the wrong direction. So, there is hope, but you have to work on these things tactic by tactic, and it's a long game. NESW has been working on a bill, the Improving Access to Mental Health Act, like I said, over 10 years. Last year, 2 of those provisions passed out of the Senate Finance Committee. We're hoping that they get through in this Congress. If they don't, we'll have to start over again. But these are signs of progress. But they regard our scope. The Congress is considering adding 2 new services that we can provide. Instead of addressing a limited definition, they want to address the limitation service by service because of the cost associated with this. And we are not right now encouraged that we'll be able to get an increase in our reimbursement, and we're only asking for 10%. Senator Debbie Stabenow, a social worker in Congress from Michigan, our champion, has introduced an amendment during that Senate hearing, but it's unlikely to move because it's perceived as just a budget issue. So if you think about what it takes to really make progress, I'm trying to give you some perspective. Through CMS and their proposed rules, some of these services were included on the regulatory front, which is encouraging. And many of you may know that I did serve on the Biden-Harris negotiated rulemaking committee for student loan debt relief. That is the process that was undertaken by the government when the Supreme Court shut down Biden's student loan cancellation plan. So we're anticipating, we had a good rulemaking session from October of 23 through February of 24, and we're anticipating proposed regulations. But we need long-term higher education reform to include implementation of child development accounts to try to supplement so that we have a mechanism to support higher education costs. these are just some kind of notes. Biden's agenda obviously includes many of our priorities. Congress has passed some spending bills, but they haven't included a lot of the health provisions, so we'll be watching out for that. Two additional items that I wanted to highlight that NESW did a lot of work on is regards getting provisions passed through a COVID spending bill, the provisions of the Employer Participation and Repayment Act. These provisions will expire in 2025, and they allow employers to pay up to $5,250 of their employees' student loans, and it would not be taxable to the employee. Now, a lot of nonprofits are not implementing these type of changes because of the cost, but these are the policies that we need to see, and we need to watch to make sure that we can get this approved and made permanent. And also that we were successful in advocating for significant changes to the public service loan forgiveness program through a waiver that helped many professionals get their student loans forgiven after the government essentially failed in kind of delivering the promise of that program. So I have a whole number of recommendations here, but I'll just say that we need to advocate for the workforces and the clients and communities that we serve. There are many regulatory comment opportunities. I think NESW submitted at least 11 comments in the last year. We probably could have submitted 45 because that's how many proposals are relevant to our mission. We need experts to submit comments. There's going to be a couple hearings coming up in Congress soon, one on Medicare reimbursement, one on substance use disorder services access, and there's going to be a hearing on April 10th, I'm sure, with the loan servicer, Mohila, to try to hold them accountable for servicing our loans and making sure that public service professionals have access to forgiveness and student loan debt relief. So with that, I thank you for the opportunity and look forward to meeting and speaking with some of you.
Thank you. Okay, so I'll let you introduce yourself, Dr. Ramich, but I'll just say the title of your presentation, Wage Equity for Nonprofit Human Services Workers. A study of work and pay in Seattle and King County.
Thank you, Jennifer, from one to another. Hi, I'm Jenny Romick from the University of Washington, the other Washington in Seattle. And it's great to be in a room full of fellow players in the long game. And given that we have Final Four games tonight, I'll think about basketball analogies. And sometimes you're shooting 3-pointers and sometimes you're fighting over loose balls. But I'm here to talk a little bit about the actual policy work and good news, short-term policy victories that came out of this wage study in Seattle. I do have a QR code if you want to hold your devices up and see our clunky website. But I'll talk a little bit more about this work. This began probably 4-ish years ago when, so I sit at the School of Social Work at the University of Washington in Seattle. And as someone lucky enough to be in academia in a practice setting, I've done a lot of work with local government, city, county, and Washington State. And I got a call from somebody I'd worked with in the city government saying, we're thinking about funding this work on human services. How would you scope it? How should we think about it? And we had a few conversations, and then my colleague and I realized we should stop talking to you because we want to actually do this work. So the City of Seattle Human Services Department was convinced by years of lobbying by the Seattle Human Services Coalition, a group of executive directors of nonprofit organizations that hire these human services workers that we're talking about here. They were convinced to fund research, fund a study to accompany their advocacy. And the purpose of the study was to use a comparable worth analysis and to estimate the extent of the wage gap between human services workers and the rest of the economy. And this was a super exciting question as someone who trains social workers who are working in and often leading human services organizations. I was really interested in it. And as somebody who's always been interested in inequalities in the labor market, I was further interested in it. We were lucky enough to get a dream team of folks willing to work with us on this. Nancy Fulbray, the work she talked about here, she and her colleagues headed up what we call the market analysis part of our work. Ariana and colleagues headed up the more comparable worth inspired job analysis, and she showed the parts of that. And Dr. Krishana Lloyd, who you saw her work in the first part, was the leader of our accompanying historical and policy analysis. And we really did this work coming from the foundation that she outlined, that these inequalities are baked into our systems in ways that reflect longstanding racial and gendered and intersectional forces in American history. So anyhow, that's a lot to put on one little discussion in front of Seattle City Council, but that's how we did it. So our main findings came out of the Nancy's team's work. This is essentially the same story that Nancy showed in the national data, although the pay disparities were a little more stark in Washington State. We have a economy known for engineering and technology. We build airplanes, not well, apparently, unfortunately, these days. And we have a global logistics company that used to be an online bookseller headquartered in Seattle. And so between Microsoft, Amazon, Boeing, we have a lot of fields that are dominated by high-paid white male jobs, and then the type of occupational segregation that accompanies all those forces. So this was our headline finding from the market analysis, where Nancy's team used American Community Survey data and then also backed this up using Washington State employment data that fundamentally told the same story. There is an underpayment. It is not attributable to anything observable we can see. They did a complementary switching analysis. It's not attributable to anything unobservable we think is there. There is a real pay gap between human services workers and the rest of the economy, between human services workers and other care workers, teachers and healthcare workers. And this gap is most stark when you think about the human services workers working in nonprofits. And the comparable worth, the job-to-job evaluation that Ariana showed, really lent credibility to the big numbers by saying it's not because the jobs are different. These wage gaps are not because the jobs require less skill or knowledge. They are in spite of the jobs actually being as demanding or more demanding than the other jobs. So we did the research. Academics like doing that. But part of our deliverables were to come up with recommendations. And turns out a group of largely scholars are real comfortable having vague recommendations at the end of an article, but get really prickly and nervous when we have to make specific recommendations to city council who's actually going to read them. But we worked through that, and we did that. And we came up with a set of 7 recommendations overall. The short run ones we thought were things that could reasonably happen in the next few budget cycles. The headline one, of course, is to raise real wages by a minimum of 7%. That number kind of both fit the local inflation we were seeing, and that also came out of an analysis that the market team did looking at workers in the state employment records, state UI records, who had switched from human services to a different industry. On net, they saw about a 7% hourly pay raise a year later. The actual increase in take-home income was much larger because they also got more hours. You can read all the details on the QR, but so the 7% number we thought was both realistic and evidence-based. We wanted to make sure that that was not going to be eaten away by inflation adjustments or making jobs harder or cutting benefits. And we further urged the city to think about the role that wage inequalities were playing in larger racial and gender inequalities in the state. Seattle city government, all of the offices have a anti-racism task force, but they weren't explicitly looking at wages, which is wrong. And so we pushed them to explicitly do that. In terms of longer term, we weren't willing to put a number on this, but we did do some math for people. And we said, you know, if you have a 37% wage gap, the asymmetry in percentages actually mean you need more than a 50% increase to close that. And so we said, you know, this can't be a one and done. We really, to actually address this wage, we need to be thinking about it over time. And one last thing, because I'm out of time here, is we really urge them to, again, think about the roles that public contracts are paying in maintaining these wage inequalities. Public contracts with nonprofits pay for people to do caring work. Public contracts with construction firms pay for people to fill potholes and take down trees and things like that. As long as those public monies are flowing into a market economy that allows these inequalities to persist, we are reifying these structural inequalities. So I promised good news, and the good news was the 7% wage increase did come through, along with some other bumps for the childcare workforce in particular. So that was good news, and so that was, you know, the 3-point dunk. I think we're going to be scrambling and probably playing defense over the next few years. Seattle, like many West Coast cities, has taken a turn towards the center, away from the left of the political spectrum, and we have a more conservative city council who's now asking questions. But we actually just yesterday scheduled a meeting with the new chair of the Human Services Coalition to go over our study results and keep in this conversation. So I'll put our QR code up again, but it's great to have this conversation here.
Thank you. And then lastly, but certainly not least, we have Michelle Jackson. Michelle, I'll let you introduce yourself. I know that you'll be giving us an overview of Just Pay, so I'm excited to hear about that.
Great. Thank you. Thanks, everyone. Thanks for having me today. I'm Michelle Jackson. I'm the Executive Director of the Human Services Council, and we are a coalition of over 170 human service nonprofits in New York City, and we do city and state policy on behalf of the sector. And so what's nice is I'm picking up a very nice thread about the public contracts. So nice order, because that's really what our focus is. And I think my role here today is the we're pissed off and we're not going to take it anymore, and you should too piece of this. We are not research, HSC is not a research. We're a little bit of a policy shop. We rely on the research of really smart people. And I see my role as like the pointy end of the spear of how do we take this amount of data and do something about it. So we created the Just Pay campaign, where we squarely put this problem that everyone else has illuminated really clearly onto government. The campaign tagline is to end the government exploitation of human services workers, to end poverty wages for human services workers in New York. We're very clear that government is the problem. So, as not a researcher, I just need enough data to be dangerous, and I'm glad that I can leave today with more data in our fight. In New York, these data points are not going to be a surprise for what we've heard today. Roughly 2/3 of all full-time human services workers had 2019 earnings below New York City's poverty threshold. Human services workers make about 30% less than if they did the same job in government, and about a quarter of our workforce qualifies for SNAP benefits. So why this campaign now, which I'll give a little bit more detail about the campaign itself, is going into 2020, our members said wages and being able to retain qualified workers was the #1 issue. The pandemic just highlighted the real disparity between who frontline workers are, overwhelmingly women and people of color, and how much they're paid and how essential they are. New York was obviously uniquely hit by the pandemic, and these were people who risked and lost their lives in the pandemic to make sure that people had home delivered meals, that homeless shelters stayed open, that people who could not social distance had safe places to go. And it was those workers who did it. And there's some of the lowest paid workers in New York, only behind or ahead of restaurant workers. So it really illuminated the pandemic, the need for real structural change. And nonprofit executives really took that mantle in coming to HSC and our membership and creating the Just Pay campaign. So a campaign like this requires really important framing. I think when we put research into practice, we had to take some risks, which we certainly have, but government is the predominant funder of human services. When you think of like a minimum wage campaign, it can be easy to take like a McDonald's worker, they're the one I pick on all the time, and say, they're only making, $10 an hour, they're living in shelter, they're applying for benefits. But when I ask my members, can you get me a worker that you pay that is also in a homeless shelter, that's a really tough, how do we talk about nonprofit wage disparity and not villainize the nonprofits themselves? So really being very clear about the contractual elements, that government is the predominant funder, at least in New York, that's the same in many other localities, and that they're therefore the setter and payer of wages. Contracts last 7 to 10 years in New York with no cost escalators. So that means nonprofits are scrambling to pay the difference, and no single nonprofit can break this cycle. So if one nonprofit said, I'm not taking this contract, the city or the state is like, great, okay. And so all you do is lay off staff and remove a program from the community. But if you take these contracts, you're actually perpetuating a cycle of racial and gender disparity. And that's why I don't run a direct service nonprofit. I run this. So I get to just tell people that and try to solve the problem. So this campaign really needs to be a movement. The sector has to move together and say, we're not going to take it anymore. So you've seen this data in other places. New York City human services workers are overwhelmingly women and people of color. 57%, in fact, are women of color. The jobs vary greatly from social workers to maintenance workers and everything in between. And these are really good community jobs. I think that's another thing that we should highlight. These jobs are not going to be outsourced. They are not going anywhere. And as we have an aging population, which is the conversation happening in the next room, these jobs are going to be even more critical, not less. So that is why we created the Just Pay campaign. The idea is, just pay, as in just pay us, just pay us. And amongst friends, we add a, swear word in the middle of that, just something pay, during some of our darker moments. And we were able to really kind of put practice and policy together. We are asking for regular cost of living adjustments, COLAs at the city and state level on contracts, which is kind of the standard bearer of how you can put money into these contracts, while also really looking at things like prevailing wage and kind of mimicking. Some of our workforce is unionized, not all are, but can we mimic some of these like prevailing wage, true cost of living, wage floor type conversations to lift up wages? And we were able to. I think the policy achievements are important, but more importantly, as the campaign highlights, is like we engage workers. The nonprofit sector has a lot of resources that we don't capitalize on. New York State has over 800,000 human services workers. They are voters. Also, nonprofits are more likely to, when we register voters amongst workers and clients, they are more likely voters. So we do have a political perspective that needs to be heard. So we've done, in our first year, a bunch of rallies. Last year, we did a rally of over 6,000 people and completely shut down Broadway in front of City Hall. We didn't mean to do that, but oops. And then that didn't work, so we slept outside in the rain in June with a bunch of nonprofit executives to say, listen, I'm up all night. I'm tired of losing sleep over this. Thousands of emails sent, lots of social media, a lot of different kind of traditional advocacy actions. And we took like a more brazen tone. This year for Valentine's Day, we broke up with the mayor on social media. We were like, it's not us, it's you, and I think that, I like to have a little sense of humor in this work. I think it's really important. And it also like galvanized the population. And we were able to, this is more for people afterwards, and happy to share all this, like the kind of timeline of the campaign starting in late FY21 into 22, doing actions like sending emails, doing our rallies. We've done some short films and things like that. We were actually able to get in our first year at the state a 5.4% COLA, in our second year at the state a 4% COLA, some minor investments at the city, hence why I'm breaking up with the mayor this year, until, as we came through this last budget season at the city level, we were really disappointed. The city put in 60 million that grew to 150 million. 150 million split across 100,000 workers is nothing. And even our next victory, which I'll talk about, is still not enough. But, we were able to, through kind of perseverance and really staying the course, we were actually able to, our kind of recent announcement is we were able to get a 3-year COLA deal from New York City announced. I actually missed the prep call for this because we were making the announcement at City Hall. We were able to get a 3% for 3 years, so 3, 3, and 3, so a 9% cost of living adjustment for human services workers on top of what they call this like workforce enhancement pot, which is $150 million, all of that money baselined. It's a $1.4 billion investment in human services workers. Thank you. In New York City. And it's also not enough. And I think that's a really important thing, is like, that's a step. It's a really important win. And I think it hopefully leaves some people, as we go through some, scary numbers today, some like hope of when we organize, we win. Like when we fight as a sector, we can win. And we were really able to get these policy investments because the New York City human services sector operated differently than the nonprofit sector tends to operate across the country, including in New York. And trust me, there's some people who are still like, sleeping outside? We would never. We're like, okay, you send an email, we'll do this. And so, these victories, and we still have more to do. We have to fix some of the state COLAs. You won't be surprised to learn it doesn't always cover everyone. But this COLA victory at the city is really important. And so together, this campaign over the last 2 years has gotten over $2.5 billion in investments in human services wages from the city and state. And we have a lot left to do because it's not enough. Raising 9% wages when you're paid 30% less means not good enough. So this is a little, background on the victory we got just recently. It means I can do stuff like this instead of fighting at City Hall this year, but we will be back next year, really looking at kind of what our asks are next, because we need to pass prevailing wage. We need to get a wage floor. And I think it does boil down to a lot of the like contracting processes that need to be fixed. So I too shared a URL code. Our website is justpayny.org where you can learn more. And happy to hear, I actually have a lot of, new data for me to take back for our next fight as well. So thank you.
Thank you so much. Can we get a round of applause for our panelists? This is such a great panel. I've learned so much, and Ariane and I are working jointly on a project right now about the undervaluation of human services workers, as you all know. And so I've learned a lot, and I'm excited to learn more. So the first question I have actually is for Sarah, but anyone else can answer it as well. So as a researcher, I obviously love data. You mentioned that there's not enough of it. So my question for you is, well, first of all, it's twofold. So what are some maybe good data sources that you think exist right now that can kind of tell us more about this issue? And then following up to that, what are some better ways that we can get this data?
I've spent a lot of time thinking about this, and we get the question, what does the data say? But from both chambers of Congress, from our federal agencies, when we had the conversation with HRSA, they asked us to give them a national data source, and we didn't have one to give. that's just so discouraging. And I think it goes back to some of the roots of these issues that we've described this morning. One of the challenges with social work is that we are trained as generalists, but we're also specialized, and we work across so many different settings with different scope of practice, and we leave one setting and work in another, and that's actually a strength and not a weakness. So you have to study a workforce that is quite complex relative to maybe a counselor that is mostly working in an office. We are working in the community alongside our clients in many different roles. The Council on Social Work Education has received funding over the years, as has NASW, the National Association of Social Workers, to do some research, but neither of us have a robust workforce center. Some of our scholars, some at UNC, at Chapel Hill, have a center that's working on some of this, but it's not nearly enough. Social work, it will have an interstate compact soon. The legislation, the model bills are passing in states now. I think we're up to 5 or 6 states. When 7 or states pass that bill, a compact commission will be formed along with a national data set. A data will be housed about those licensed social workers, but it's only those folks that actually apply to participate in the compact that they'll have that information. So we need funders to be interested in the workforce and in the services that we provide and the good that we do. And we need all of you to help to spur that, to have an interest in studying the workforce, which is, in social work, just doesn't seem to be as much of a focus, or seems to be much more of a focus on how we can better support our clients. But I can assure you all that if we had this information, we could uplift the workforce, but also the clients.
Thank you. I don't know if anyone else wanted to add to that. Okay. All right. So one of the other things that you all, several of you actually kind of pointed to, is the underfunding of public contracts for care work and for human services work. So what are some ways to make inroads on the idea that public contracting for care work should be more equitable relative to public contracting for other kinds of work, such as capital project construction, healthcare, or IT? Anyone can answer that.
I can jump in. Spent a lot of time thinking about this. And I think to your point, I think some of it is about the economic engine of the kind of nonprofit, well, I say nonprofit sector because that's who my people are, but human services and like care work. And so I think having a better take, and I know Seattle has done some of that work, and we've been working with other localities who've done it. Like nonprofit human services is an economic engine. And we don't blink twice about construction, tech, those types of contracts. I've never once gotten a question about like how much the head of IBM gets paid when they contract with the city to do work. And so I think from a kind of data perspective, appreciating the kind of economic engine that nonprofit human services jobs and work brings, because we're not just, jobs, but we enable other people to go to work. Childcare, and that allows people to go to work. Elder care, having a senior center where you just know your aging relative can, play around a mahjong and, have a hot meal is like it's a way that people can go to work. So the really economic opportunities of this work, I think, is important to demonstrating, like, then when you pay poverty wages, you're removing money from the economy. So there's a very clear economic argument that I think also needs to be made around some of this. And then, my default setting is always like fight harder. So what we're doing is organizing the human services sector to really say, like, I would love to just be like, it's the Just Say No campaign. Like, we're not taking these contracts anymore if you can continue to underpay them. And we've had some success in some of the smaller subsectors when certain contracts come out. So I think it is also about like local organizing around, this is a really terrible contract. And I'm like, why are you signing it? Stop signing, and trying to organize some people around that. Those pieces I think are important, in addition to some research on like how they're an economic engine in those communities.
I would also like to see more research on public health on the community level. A lot of the problems that social workers are addressing actually impose huge costs on communities, and yet there's not nearly enough research revealing the linkages. And I do think that's something that researchers could move forward with and make a real contribution.
Can I just say that having the opportunity to advocate alongside many different groups in DC, money is the problem with everything. And it's easy, I can't tell you how often I go into these spaces, and this is just one, and it feels like this is definitely the most important issue. And then you go to the next room and you're like, sheesh, this one is more important than that one. And this one is now, I don't know what we should do now. And I think that's the trouble that we're in. We need to have some solutions that don't just involve government funding. And yet this workforce is primarily reliant on that funding, which is limited, sometimes dwindling, and we are often the first to get cut.
Thank you. Oh, okay. Yeah, so we do have time, thank you all, for one or two questions from the audience. So I saw one hand here. So yeah.
Hi, really appreciated the panel, fellow social worker here. And that loan thing was real. I had a big old party when my loans were paid off. I had to just, in thinking about, my work is in early care and education, and a lot of my research is in that space. And they're very, kind of these pathways and the issues that we struggle with the workforce are very similar to social work. One thing that I'm curious about, I don't know if anybody knows, is what we're looking like in terms of people entering the profession. Like in early care and education, the numbers are dwindling substantially. Is that the same in social work, or are people coming to the field?
Well, I welcome you to weigh in too, but I will say this, the social work programs have really increased over the last decade. There are many more now online programs. So I don't know, I mean, we understand that there's a need, but it does appear that there are continuing folks are motivated to come into the profession. Now, when we did a lot of the survey data to get the PSLF waiver implemented, and we work with many different partner organizations like the Student Bar Protection Center to do that, there were more than a few comments about leaving the profession because of the low pay and high student debt.
And this is one of those kind of research findings, but turns out people are more likely to think about leaving the profession if they're low paid once they're in it. Yeah, I mean, I think the workforce and kind of entry in and staying in the workforce happens on a lot of different levels. I'm in a school of social work. We pay attention to students coming in. We're at a demographic cliff right now where there are just fewer people entering college and, kind of the early post-college graduate programs than there were a decade ago. And that's demography. You can't argue with it in a country with closed borders. But I think there's also growing awareness that I see among students that they don't want to commit to a job that's going to underpay them. And I think that is absolutely legitimate. I mean, there's been a strong movement within social work to be paid for your practicum hours, much like, craft workers. Part of the attraction to craft work, a white male dominated field, is that you get paid as an apprentice. You get paid from day one while you're learning on the job, because you're giving value on the job in terms of building your community. So I think that's, I think, in addition to the changes that are happening here, I think we need to figure out how to support and validate people coming into the profession who are saying, I don't want to work like that. I don't want to work in a nonprofit where I'm always burnt out and have substandard health care and things like that. And so, I love the type of organizing you're talking about there, because it really does have to be a collective group. I think one other thing that's happening in social work is, at least in Washington State, we've seen a lot of people entering the field to become behavioral health providers, which is a huge need, but it's not the only thing happening in human services. And by entering something that's healthcare adjacent, people can make a living that's adjacent to healthcare, which is better wages. And so I think making sure that people doing frontline community organizing, elder care, youth care, food programming on the local level, that they're able to stay in that work and have a dignified and reasonable quality of life. Nobody enters this thinking they're going to get rich, but people would love to be stably housed and be able to take care of their kids' needs and their family's needs. So, yeah, I think there's action to be paid attention to on a lot of levels.
Thank you. So we just have time for one more question, unfortunately. Does anyone else have a question? I saw.
Hi, Catherine Goldstein from Better Life Lab at New America. Dr. Fulbury mentioned decline in unionization, and I was curious if unions were playing a role in New York or in Seattle in these fights, and as care workers have made big advances in both of those areas through unionization.
Yeah, so we are lucky to have really good union partners in New York. There's a home care workers campaign right now at the state level, and the union that represents home care workers has been really integral into that perspective. And being part of that fight, like they're on the front lines, they're really up, like literally up there right now today in Albany, and then at the local level, DC 37 is the city's municipal union, and they also represent, they just took over the daycare contracts because they merged with a different union. And, unfortunately, my members are about a third unionized, a third partially unionized, a third no union involvement at all. And unionized workers don't make more than their non-unionized counterparts in New York, from what we found. Very anecdotal, again. Not a researcher, so this is not like, I don't have a study to this. This is like a hands up, hands down kind of like scenario. And so unions haven't been able to crack the kind of triangular negotiations that happen. Like a union comes to a nonprofit leader and says, we want $2 million more in salaries. And the nonprofit leader is like, well, we're 90% government funded. So good luck. Let's do this together. But unions haven't always picked up the kind of thread of like, it's a negotiation between the union management and government. And so, but, DC 37 was crucial in our, COLA victory. We stood side by side with them at the press conference and things like that. So there's kind of like some of that is starting to happen and some of it isn't. But we have just found, unfortunately, the unionization, I think the sector should just unionize like itself. I represent management, so I can't say that out loud in New York. I can say it here. I've left the state lines, but that's just been, as it's all recorded, but I've said worse, I think that unionization has not necessarily helped. It doesn't mean that it wouldn't help, but it's, the kind of underpinnings have been a little back and forth in New York, at least.
Thank you. And thank you to, did you? Okay. Thank you so much to our panelists. One more round of applause. I'm going to pass the mic over to our Chief Strategy Officer, Dr. Robin Watson-Ellerby.
Thank you, Jennifer. All righty, thank you. Thank you. Back over at the podium. So, can you guys hear me? Thank you. I told you I'm going to keep saying that. So, beyond emphasizing the undervaluation of care work and the challenges in earnings, I think, what this panel has done is also highlighted the need for data, for research, and as Nancy said, at all levels, for recommendations. And I think what's also highlighted is the need for collaboration from research think tanks, membership associations, universities, and so forth, who are all in this kind of good fight. And I'd be remiss if I didn't say the need for funding. I think that was important to highlight. And I think all of this collaboration and all of this data and research is needed so that we can have organizations like Michelle's, the Human Services Council, make the information actionable, even if it means breaking up with the mayor. So I want to say again, thank you to Jennifer, Ariane, Michelle, Nancy, Jenny, and Sarah. If you can give them another hand of applause. All righty. So we've had an excellent first half of this conference, and now it is time for lunch. So, so the lunch will be served in the reception hall. And again, this is a time to eat, to network, to also do these brief interviews if you're willing. I'm going to keep lifting those up. I'm also going to lift up wanting you to engage online with the hashtags IWPR Research, 1R at the beginning, and hashtag Care Conference. Following lunch at 1:45, we will have 2 more parallel sessions. The workshop 3, Care, Immigration, and Job Quality, is in the breakout room over there. And then back over here, we will have the care infrastructure, measuring gaps and identifying funding sources for closing them. All right. Well, in the meantime, have a good lunch, and I will see you back here at 1:45. Thank you.